In today's video, we are going to learn some anatomical terms. So, first you have to know the anatomical position for the description of these terms. So, the anatomical position is in which the subject stands erect with the face forward and the arms to the side, with the palms turned forward and the fingers extended. The feet are flat on the floor and directed forward. The toes are pointed forward. So this is the basic anatomical position you see here. Now let's learn the anatomical terms. First one is superior and inferior. Superior means towards the head end, to the upper part. And inferior means away from the head end, the lower part from the head. For example, we can say that the forehead is superior to the nose, or the eyes are superior to the nose, or the nose is superior to the mouth, etc., etc. And we can say the opposite for inferior. The nose is inferior to the eyes, the mouth is inferior to the nose, etc. The next is the anterior and posterior. The anterior or ventral is the front of the body, so all of the front part, and the posterior or dorsal is the back of the body. The back portion of the body is the posterior part. Example for anterior is that the abdominal muscles are anterior to the intestines, and for the posterior is heart is posterior to the breastbone. The next terms are proximal and distal. Proximal is nearest point of attachment to the limb, and distal is away from the point of attachment of limb. So limbs we mean here are the hands and the legs. Their point of attachment is what we mean here. The example for proximal term is that the elbow is proximal to the wrist, and for distal, the phalanges are distal to carpals, which are distal to the elbow. And just the opposite is for the proximal, which would be elbows proximal to carpals, and carpals are proximal to the phalanges, and so on. Next two terms are superficial or external, and deep or internal. Superficial means towards the body surface, and deep means away from body surface, more internal, that is inside, into, internal, whereas superficial is external. Example for superficial is that the skin is superficial to the skeleton. The lungs are deep to the rib cage, internal part, okay? So that is the superficial and deep. The next one is lateral and medial. Lateral is away from the midline of the body, so the middle of the body or the midline of the body. Away from that is lateral, and towards the midline of the body is medial. Example for lateral would be the arms are lateral to the chest and the lateral side, away from the midline. The heart is medial to the arm. Heart is more to the middle of the body than the arm. Then we have some more terms such as intermediate, which means between two structures. For example, elbow is intermediate to forearm and arm. Elbow is between the arm and forearm. Ipsilateral means on the same side of the body as another structure. Example is left arm and left leg, which are on the same side. Whereas contralateral means on the opposite side of the body from another structure, for example, left leg and right arm.